Hi YouTube, this is Angela, aka Lady Angela, and I just wanted to give an update on my lap band surgery. Okay, this is what my situation is now. I shared with all that I was approved. I was approved last Friday, and that was really great news for me. I was really happy about that. So, um, after getting approved, I had to basically wait to get the actual hard copy, or either for the weight loss center to do a verbal over the phone, or by fax, or via email. So the facility, they did receive their approval, so that's all great. So there was some new information that came about that was totally surprising for me, and that is, well, first of all, I live in Southern California. I live in San Diego, and so far I have seen the doctors here, the surgeons here, and I've also done all my pre-op procedures here, such as the upper GI, my sleep study, my psych eval, which I was able to do that over the phone, and basically pass that over the phone. So I was told. So everything was great on that part. Now, when we get down to the nitty-gritty part in regards to getting a surgery date scheduled. So what I was told is that I will have to go to Long Beach, since it is the closest to me, considering the other options that I had. Now I have to go to Long Beach, California, excuse me, for my pre-op, and that's to meet the surgeon, and he will basically get me cleared for surgery. So, with that being said, that was new to me because I didn't really want to have to go to Long Beach. Long Beach from San Diego was about an hour and a half, maybe 2 to 2 hours and a half, with traffic. So I will get to do that next Wednesday, the 17th. Now, once I meet with the surgeon, he's able to. Now, he only does surgeries on Fridays as well. So that Friday will be the 19th. So, speaking with his surgery scheduler, she says that he has 14 surgeries scheduled that day, and it depends upon him if he's able to get me in. So that's doing a whole lot. Also, some new information is that with my insurance, they require that I have this procedure done, the lap band procedure done at a COE, which is a Center of Excellence, basically a hospital. And with that, I would have an overnight stay, so it wouldn't be outpatient like I was hoping and like I was told for these past 4 months. So this was a lot of new information. I mean, I was very excited. I was very happy about being approved. I wouldn't say I really pushed the issue, but I kept in contact with the insurance company, with the weight loss center, to make sure I didn't get just kind of left behind or whatnot. But I knew that they were going to get to me. I was just excited, like I think everybody else is. You want to get your stuff taken care of. So I believe that's to be expected. So, however, with all that being said, I go next Wednesday to have a pre-op visit with my surgeon in Long Beach. During this visit, he will go over a lot of my medical history that was done as far as their pre-op requirements, such as the sleep study, the blood work, ultrasound, upper GI, psych eval, all these things. Now, everything I've passed and I'm cleared with. And also, I am a little bit of my medical history. I'm a cancer survivor of 2 years. I had renal cancer, and thank God it's gone. It was removed surgically. So, but I'm sure that's pretty much something he will be discussing with me as well. So I can understand that. And with any surgery, you do have to have certain clearances, which is um, a cardiac clearance, which is basically a chest X-ray, EKG, which is performed. So I've had those done yesterday. As a matter of fact, I had those done with my primary care doctor. So those results will be available for me by Friday. So that's good. So, however, during this visit, and again, he should probably clear me to do, or clear me for surgery this Friday. I'm sorry, next Friday, the 19th. Now, with that being done, the lady that does the surgery, she wants me to call her to let her know, because she says that he doesn't do the schedule, she does, and it's very important that she is in the loop. Okay, because I don't want to appear up at no hospital and then I'm not actually even scheduled, especially out of town. So that would be devastating for me. So, however, I'm not happy about that. I was really bothered with it because I wasn't informed in the beginning of my journey with this particular weight loss center here in San Diego, which is actually they call top surgeons out of LA. So, if anyone is affiliated or have had their procedures through them, maybe you can, shoot me a comment to let me know how they do what they do. Were you satisfied with their method of patient care as far as how they, uh, work with you through your journey. Um, so I'm glad about it. I just wasn't anticipating having to spend a night in a hospital. Have had my share of surgeries, a lot of them due to my weight or complications that was brought about, you know, being heavy. So I really don't know how to feel. To one of my subscribers and weight loss journey buddies, Tina, I totally understand how you feel about that December date. It can just you're happy, but it's like they kind of like took your joy by telling you something 2 and 3 weeks out. Whereas with myself, um, at the earliest I could have it on the 19th. Now, mind you, I do the pre-op visit with the doctor next Wednesday, meet him, discuss my medical issues and whatnot, and can possibly have the surgery 2 days later. Now, that means I will need to go on my pre-op diet this Friday, being the 12th. Um, One good thing came out of this. Uh, my my weight, my current weight is 246. I kind of flip flop between 243 in the morning, and at the end of the day, I'm 246. I've been on and off my pre-op diet for the past maybe 2 weeks now because I kind of wanted to get a heads up to see how I would do with these shakes, to see the protein shakes that is, and they're not that bad. I mean, I know some people may have had them and they're just, like these are awful. I hate these type of things, but I kind of hooked mine up. So, and I stay within my boundaries as far as my intake is the grams of fat, the sugars and whatnot. I'm lactose intolerant, so that was a must that I find all dairy products that was lactose and soy free, plus giving me some healthy nutrients that I need. So that worked out. I added frozen berries with it, honey, and they are all right. I mean, they're feasible. I can stand to do a shake, or two a day, and that's what's required of my pre-op diet is protein shake in the morning, 4 ounces of chicken, turkey, or fish, half a cup of salad with vinegar or lemon juice squeezed over for the dressing, a cup of raw vegetables or steamed vegetables, and I think it's a half a cup or a cup of broth, chicken or beef. So I do get a meal a day. So that's not that bad. I can handle that. Now, like I was just saying before I gave you all that information, um, I only have to do my pre-op for a week. So that's good. So I'm not, I'm undecided about starting the pre-op this Friday because once I see this, the surgeon, if he's not able to get me in for surgery at the hospital 2 days later, then those will just be additional days I've been on pre-op. I'll benefit, of course, from it by hopefully losing, some pounds, ounces, or whatnot, inch or something. I can kind of tell now in my clothes because again I've been on and off my pre-op. I'm really watching what I'm eating. Today, me and my husband went and had some Denny's. We had breakfast, so I ordered what I normally would order. Pancakes and this ham and eggs, and I couldn't eat it. I mean, I felt as if I was banded already. I guess it's a mental thing as well. But I mean, I was stuffed and I hadn't even ate half of the food, and I didn't overindulge. I ate, I was satisfied, and I left it alone. So I think that's really the main thing that I'm looking for also is control, and not just, overindulging and just, overdoing it with a plate of food. So anyhow, so it's a little bit of good news and bad news. So um, I guess I have to accept that. I also shared with my weight loss buddy, Linnell, to live smart. That's her her name on here. So, uh, but I discussed with her more in detail about what I was going through because I was really upset. And my husband, he supports me 110%. I don't really have a lot of people supporting me outside of YouTube and my weight loss community. And what I mean by that is that a lot of people just don't know. I just don't share a lot of my personal business because a lot of people are really quick to give you a lot of negative information versus trying to uplift you or encourage you, for yourself. So, however, I do have an option of just going through the Thanksgiving, holiday and having my procedure December 3rd, which would probably work better for me. So, um, anyhow, I just kind of want to give you guys an update. Give me comments, suggestions on the protein shakes, how to deal with this. Also, this procedure is going to be at a hospital in Southern California out of the LA area called Marina Del Rey Hospital. And it is also a bariatric hospital. It's a center of excellence. So if anyone has had their procedure there, can you please shoot me a comment or a message to let me know, what's your input, how was it there, just that kind of thing. I'm curious. I'm not all super amped like I was before, and I think I'm looking at this on a different perspective now. You know, it's more of a business thing on my side because this is it's going to change everything about me. The way I look at food, the way I look at my health, the way I input this with my family. So, um, however, I hope everyone is doing well. I hope the ones that are in Wonderland stay in Wonderland. Do your thing. Best wishes to all. Um, and this is Angela again.